There are certain things that you may do that can affect your bottom line, including your health. Local CPA Phil Umansky is back with us, ready to talk about this very topic. Phil, it's great to see you again.
Good to be here, Jessica.
Always a pleasure.
Thank you.
I love sitting down with you. You have so much insight on the dollars and cents of it all, and this is particularly fascinating. Give us the outline of what we're covering.
Okay, well, most of the time, if we were to go to a store to buy a car, we would want to know the price of it, wouldn't we?
Yeah, that would be
$15,000 or $20,000. So there are some bad things that we could do that we purchase that we don't really know the bottom line in terms of what they're going to cost us. And I call these vices. They could be bad habits. And the thing is, sometimes you get into a bad habit and you don't really realize what it's going to cost you over a lifetime. And that's what we're going to be discussing today.
Because these little or big, I have a feeling these are probably small things that add up. It makes a bigger picture over time.
Absolutely. And these all relate to your health. And we all know that health can be expensive. So I've got three, and these are three just as an examples, and these are some of the biggest three.
Okay.
So the first one is smoking. Smoking is an addiction, and sometimes when you begin smoking, you don't really realize the cost of what's going to happen. So really what I want to do is to bring to your viewers the cost of these. So let's start with cigarettes, and let me just give you an example here. Okay, a cigarette now costs about $6.16 per pack. So let's say that you have a pack-a-day habit. You're going to be spending $187 a month, which comes to $2,248 to buy those cigarettes.
Wow.
Now, if you're in a middle income, that's a lot of money.
Yeah.
But there's a higher cost to that, and that is what you're doing to your health. And the health care for smoking includes COPD, emphysema, a lot of bad diseases like lung cancer. And you may go a year and that doesn't affect you, but you may go to age 75 and you find yourself with lung cancer. So it's been estimated by the government that smoking costs $300 billion per year. And actually buying the cigarettes is a small cost. It's the prevention and treatment after you come out with these diseases.
And Phil, you mentioned the litany of diseases and implications of smoking. And not only is that an issue on your health, right?
Yes.
But if you end up requiring prescription care, that's part of that. But if you think that that's expensive, then maybe try the cost of paying for those prescriptions too. So it all adds up. And
so there right now, the CDC estimates that just for direct medical costs, it's $170 billion. There are 16 million smokers. So if you take the $170 billion cost and divide it by the 16 million smokers, that comes out to $10,000 a year.
Yeah.
So if you smoke this year, you may not have to pay that $10,000, but maybe when you get to age 70 or 75, you're paying $10,000 through health care to remedy whatever disease you come down with as a result of smoking.
So we may be interested in stopping smoking, and this is a great motivator because then that wallet sees the benefits.
The wallet. So a lot of times people make decisions not based on their wallet, but other things. I say make decisions based on other things and your wallet.
And your wallet, a double whammy.
And your wallet, absolutely, absolutely.
So Phil, we have about 2 minutes left. You mentioned three. Smoking is a big one.
Yes. Okay, now alcohol in moderation is fine, but we're talking about alcohol abuse. Okay, it may not necessarily be just being an alcoholic. There are a lot of people that abuse alcohol. So misuse of alcohol costs $249 billion per year. There are estimated that 15 billion individuals have some issue with alcohol abuse. That comes to $16,490 per year per person. Could be lost productivity at work. There's some other causes. You know, people that can become alcohol abusers get divorced very frequently.
So relationships
can be expensive. And then the other one is heroin addiction. We hear a lot about that. It's estimated that the cost is $51 billion per year, spread across 1 million active users. that's $51,000 per person.
It really is impactful, and this seems, when you're in the throes of an addiction, the dollars and cents of it are certainly not top of mind, but if it registers at a certain point, this adds up in so many ways.
It does, and your next guest deals with health insurance, and a lot of these are going to be cycled into what your health insurance premiums are going to be, because a lot of health insurance covers these. So my advice to your audience, and I know that you have a public service mission as a station, is before you pick up any addictive habit, think about it, and also think about the money aspects of it.
Bill, thank you so much.
You're quite welcome.
Great to have you back. Right now, we're going to send it over your way.